first order of business, we need to come up with a name for what we're doing right now.
We do. It's kind of poor planning. We came into this room, we set everything up, and then we were like, shoot, we don't have a name.
Yeah, we've got everything else. We don't have a name.
We need to identify ourselves. Who are we?
What are we?
Yeah. But what we are is we're just trying to talk about the issues that aren't necessarily hidden per se, but just people don't know where to look. So we can start based off of that.
Yeah. I think the thing we're trying to do here is, I think we talked about this earlier too, we're trying to improve the resolution of the issues that already exist. Because people understand to a certain degree that there are problems within society.
Yeah, they face the problems, yeah.
Exactly. But it's not, we just don't know how those problems exist and what they mean for us and what we can do about them.
Right.
Or even who's causing them.
Right. And the information is out there. It's just we're helping people find it. So resolution I like.
Something about like enhancing the resolution, because we talked about this in our neuroscience class.
Yeah.
And, when you take an fMRI, you get a much higher resolution, spatially talking, compared to, say, an EEG.
Yeah.
So what is it about like us that we're enhancing the resolution in a way? And I really like the word resolution because it's got multiple meanings. Not only does it mean resolution in terms of spatial resolution, but we're also resolving some issues. Yeah, hopefully.
Yeah,
eventually.
Yeah. Our goal is to resolve some issues.
Yeah.
Whether we do it is another question, but spatial resolution is good, except I feel like it's just missing that
oomph.
Yeah.
So what can we do that enhances something to do with enhancement, improvement, just uncovering, shedding light? I'm going off of those terms, something like that.
I don't know. It is difficult to come up with something on the spot. We literally put ourselves on the spot.
We did.
Recording it too, but spatial resolution, shedding light.
You know what? I'm going to do the lamest thing possible, and I'm going to look up synonyms. This is synonyms. Synonyms for enhance. To increase, add to, intensify. I like intensify.
Intensify. I think
amplify
can come with alliteration too. That might be an easy way out for some oomph. So
I don't know. Are we street artists? Alliteration. We could go with that. Amplifying the resolution.
Intensity.
Resolution amplified. Augmented resolution.
Spatially resolved.
Heightened resolution.
No, it doesn't have that oomph.
You wanted some alliteration. Reinforced resolution.
I don't know. It's going to be so hard. Reinforce. What do you think of spatially resolved? It's not resolved. That's the issue.
Because it's a work in progress.
Yeah. Spatially resolving. Spatially refining.
But
spatially refinement.
My problem is with the word spatial. Like, if we were talking about a specific issue that's like very domestically located, spatial would have been cool. But I think here we're talking about issues that some of them affect people globally. So I don't like to use the word spatial just because it's too constricted to a single space and time, a single location in space and time.
I see. We are focusing on Canada, though. That's one thing we should mention. The podcast is based upon Health Frontiers Canada, where
Yeah.
we'll talk about that more, but yeah, we're focusing on the Canadian healthcare system. So
Yeah.
is there anything you can think about that? In some way, that's local. It's national.
True. How about this? I'll talk a little bit about Health Frontiers Canada for a little bit,
Yeah,
and we can see if we can come up with some terms.
yeah, and maybe at the end of the podcast we can come up with a name.
I like that.
We can talk through it and we can rationalize something out.
You know what? I like that.
Okay,
Let's
me
go
too.
with that.
Yeah.
So, what is Health Frontiers Canada? When it started off, it was basically the goal was to create a patient-centered advocacy group that was dedicated to improve timely access to due care for all Canadians.
Mm-hmm.
What that means is reducing wait times, reducing the care apathy in the system that we see right now, and then also increasing sort of the approachability and transparency within the system, so that anyone looking for care knows that they can reach out to someone and that someone's right around the corner ready to help them, and also that their care is transparent enough that they are presented with all the options that are best for them and not just what's most cost effective or what's the easiest for
Right.
the care team to take care of and to get rid of as soon as possible.
Right. In a more, I guess, holistic way, they're looked at.
Yeah.
And I think, especially as someone who moved to BC recently, it can be daunting to try and find any doctor or just even navigate the system outside of primary care. And yeah, to be honest, like when I came here, I didn't even think about having to find a doctor or anything like that, because I am from another Canadian province, so I can't imagine what it's like for someone from like overseas.
The other end of the world.
Yeah. Like they're not only do they have to find a new doctor, the entire system they're navigating is just entirely different. They come from different political systems, different healthcare systems. So yeah, that must be insane.
Yeah. And, that was sort of at the forefront of my mind when I was looking into starting this nonprofit. And it was, how can we help those who have been systemically disadvantaged
Right.
by the system? Not necessarily because of malicious intents, but just because of the strains of the system and sort of the nuances that you don't understand
Right.
until you've existed in the system long enough and experienced sort of the different versions of receiving care in this country.
Right.
And in a country like Canada, where we do have sort of this utopian ideal of how healthcare should be delivered, how timely healthcare is a right, that's, I think, as foundational as a belief as can be in Canada. I think with that understanding, it's really hard to then look at the reality and be like, oh, it's not actually easy to get care.
Right, and it's funny because when I'm sure someone from the U.S. who believes in universal health care looks up at Canada, it's like, wow, I wish I lived there.
Yeah.
And they don't know. Like, they don't know what's going on.
Yeah.
Like, you come here, and then you see that there are, we'll go into the statistics later, but there are year-long wait times for essential surgeries.
Yeah.
There are most people are, like, a lot of people are in worry of losing their family doctor.
100%.
You're right, it's far from the utopian ideal that it seems to be to people outside the country.
Yeah. And I think not just the United States, but people around the world hail Canada as,
right,
just this perfect little
Yeah.
country with healthcare access for everyone. But I think living here for most of our lives, you've realized that couldn't be further from the truth.
right.
I think that's why we began on this journey to not just advocate for people, but to try to change the system itself.
Right. I'm going to write that down. For potential names, that the things, what I wrote down is things are not as they seem for at least Canadian healthcare.
I like that.
Yeah.
I like that, yeah. Things are not as they seem. And I think it serves those in power right now to sort of go back to that notion of, oh, our healthcare is amazing.
Yeah.
People around the world look up to
Right.
us. And I think that's a reality for a lot of people that do move to Canada.
Yeah.
They expect that they're coming into a system where healthcare is not only accessible but freely available to everyone.
Right.
And I think it must be a culture shock for a number of international students, not just around us, but also refugees and other immigrants who come into Canada fleeing all sorts of places and all sorts of prosecution. And when they get here, I think for them to realize that promise of Canadian healthcare is false.
Right.
And that people in dire need of care have to suffer atrocious, painful wait times just to get an elective procedure done, or
right.
to even see, forget a specialist, even a primary care physician.
Yeah.
That has got to be heartbreaking.
It does. And even like at UBC, where we go to school, the ER, it's open from 8 a.m. to 8 p.m. Figure, like, coming, like, what if you're having a heart attack and it's 10 p.m. in the night?
Sorry, sir, it's 10 p.m. You're gonna have to head to VGH or something.
And if you die on the way, you die. We just can't open our hours.
Yeah.
It's crazy to me.
I hear Uber's working.
I didn't even know emergencies like that exist. And if I don't know that they exist, and I'm having a heart attack, then you might accidentally go to the UBC hospital with like no knowledge that it closes at 8 p.m. So, and the lack of planning that goes into that can also feed into, there's more time before you actually see a doctor while you're having a heart attack or something that needs immediate attention. So, yeah, that's insane to me. We'll go into some more stories soon.
Yeah.
About stories we've had at UBC. And
absolutely.
Vancouver.
It's still it astonishes me. Like I'm laughing, but it's laughing through the pain.
Yeah, exactly.
We're the closest hospital to us. Just the fact that an emergency room has wait times, that it closes after a certain hour,
right.
In a major city like Vancouver, is just astonishing to me.
It is, and I'm from a smaller city, Calgary, and it's a lot different there. And I think in another episode we'll explore the differences between provinces. But we just the system is different there, and the wait times I think are a bit less there.
Mm-hmm.
And there's just when I came here, the health authorities confused me a little. Like there's 6 here, I think, right?
Something like that.
So, just a lot more than the one that's in Alberta. But it is entirely different, and we'll go into that later as well. So, I think
I say we given that we have started. What we do have is a name for this episode, which is the Silent Treatment Desert of Canada, and that name sort of originates from what we're going to talk about now, about how the healthcare in Canada, it's available, it's there, but it's inaccessible, and no one knows that it's that inaccessible until they actually end up in a situation where they don't want to be, where they have had a medical emergency of some sort, where they have been diagnosed, or where they have had symptoms for a prolonged period of time, and then they try to access that care. Because I think I was reading in the CBC the other day, when you're sort of under the age of 40, really the major things you're worried about are accidents, because strokes are fairly rare, heart attacks are fairly rare, coronary artery disease, even those people who do end up developing it usually end up developing it later in their life. Not to say that young people don't have chronic illnesses.
They're not worried about it as much.
Especially if you have been fairly healthy your entire life. It couldn't be me, but if you have been fairly healthy your entire life, you don't think about healthcare all that often until you're in a situation where you either need care or, unfortunately, a loved one does.
Right, and it kind of reinforces the strain on the system, a lack of knowledge that someone has about the system can have, because I think I have some statistics here, but
go for it.
73% of BC residents know that physicians decrease emergency room visits, and so that's almost 30% of BC residents not knowing that having a family physician can decrease emergency room visits. So the one thing that does is it increases the strain on the system through emergency rooms, and it's based on a lack of knowledge. So knowing the knowledge beforehand, before the emergency arises, it can not only help the patient themselves, but the overall system.
Totally. When I see that statistic that says that 73% of BC residents know that family physicians decrease emergency room visits, what I see is like a stark contrast with the fact that nearly 1 million BC residents right now, which I guess is like a quarter of the population almost, if not a little under, the quarter of the population does not have a family doctor right now. And 73% of BC residents do realize that having a family doctor would reduce their emergency room visits. So we have a population that knows they need family doctors so that they don't have to go to the emergency room as often. We have a quarter of the population that does not have a family doctor right now. What that tells me is that the system is failing all of these people.
Right.
It's failing everyone who wants a family doctor, who knows they need a family doctor to get proper care, to be their advocate in the system, especially when the system is this hard to navigate, especially when people are new to the system.
Right.
And what we see is, again, back to that statistic where 1 million BC residents don't have a family doctor.
And even the people that do have a family doctor have no confidence in the system. So 40% of BC residents that have a family doctor are concerned about losing theirs. And from what I've read, it's primarily due to physicians retiring and clinics shutting down. So then that goes back into training and supplying more family doctors. But it's not just the people that don't have a family doctor that we're failing, but it's the people that do as well.
So on one hand, we have a rapidly aging physician population that is nearing retirement, and rightfully so. I don't want to be working when I'm 82.
Yeah. I actually, there was in Calgary, there's a family doctor that's around, I think, in their high 70s.
Wow.
That's still practicing. Their clinic, one of the clinic that they were working in, it shut down, and they're looking to move clinics, so they're not thinking about retirement.
Wow.
That's insane.
More power to them.
More power to them, but I don't know their reasoning, but that's crazy to me. Good for them.
Yeah, but at the same time, what I see is a compassionate physician who understands that them not giving their best in their twilight years would mean that their patients are going to suffer.
Right.
And it's almost a system that prevents them from leaving or shames them for leaving. When this was Alberta, in another province with a lack of family doctors, they feel a certain responsibility that if they leave, their patients would be orphaned, as that's sort of the term that I've heard being used by other physicians when they talk about a family doctor leaving. So on one hand, we've got an aging physician population that is nearing retirement, and on the other hand, we're below replacement levels when it comes to training more physicians. Yeah,
I think you were talking about this to me a while ago, but there's a lot of constraints on how many doctors they can train through medical schools and opening new medical schools and
then residency spots.
Yeah, they're tough.
Yeah, I think it goes back to funding and money from the provincial and federal government. We have in Canada what is sort of a dual payer system where the provincial and federal government work together to fund healthcare for their residents. What that means is that the federal government reimburses the provincial government, or rather sends them funds proportional to the number of residents, which means that even though the system is really under terrible strains here in BC, provinces on the East Coast that with really small populations, even I guess Saskatchewan in that case, and Manitoba, provinces with smaller populations suffer more because they get money and funding proportional to their population. Exactly. Yeah. And the people who are covered under the provincial health plan there.
Right.
Which means that they have to make do with a very small amount of money,
even less funding,
to go around for everyone in that province. And it goes back to that point that, the system is overloaded, not just in terms of the wait times, but also funding for basic things like purchasing technologies like MRIs. Right now, I think the MRI wait times are through the roof as well, which, again, I can't begin to talk about how problematic that is, because if you don't have access to an MRI machine right away or within a reasonable period of time, I think the last time I went for an MRI, I had to get a head scan done. It took me, I think it was about a 3-month wait time, and this was
wow.
before the pandemic.
Yeah.
A 3-month wait time before the pandemic, where I had to go for a scan, and like they didn't know what it was. It took 3 months for me to get the
What
scan.
happened to you at the time?
I was having some issues with my vision, and my ophthalmologist recommended that I get the scan done. And after I got the referral for the scan, 3 months later, I get a call, hey, could you now schedule an MRI scan for the next upcoming weeks?
You were having problems with your vision during that time?
That's right, yeah.
Oh, wow.
And
so you were in the dark, literally and metaphorically too.
Quite literally, yeah. I was, this is back when I was in middle school, and I'll be honest, it scared the crap out of me, because I wasn't sure what was going on with me, and as a kid, you're not that accustomed to, having health issues, and then being like, okay, you know what, I'm in good hands, it'll be handled. It did feel like I was sort of led astray quite a few times, but I was really fortunate to have a family doctor who was able to advocate for me within the system and help out just tremendously. And, having him in my corner, it really felt like, and, he's still my family doctor.
Right.
Having him in my corner over the past decade at this point has been just such a tremendous help. And I can't imagine those outcomes being as positive as they were without him.
Well, I think that speaks a lot to, like, based on how you feel, how the whole BC population would feel if they did have a family doctor, because the way you say having someone in your corner is incredibly important compared to just merely going in for a walk-in visit or something like that.
Absolutely.
I have another stat here where 90% of BC residents that have a family physician say that they play a significant role in their health, similar to how you're saying. Yeah. So people who do have it genuinely do believe that they're making a difference in their lives. It's just about getting it and actually feeling the effects of it. Until then, you won't realize.
So almost everyone who has a family doctor. Almost everyone who has a family doctor thinks that they make a tremendous difference in their lives.
Right, and there's some information about why, and it's primarily, like what you said, to do with continuity of care. Absolutely. So having someone in your corner, someone that's still your family doctor that you can talk to, that knows you. Yeah, that's important.
Yeah, and when I was talking about inaccessibility, it boils down to sort of wait times and sort of a lack of advocacy within the system. Having a family doctor sort of takes care of both of them, because a family doctor can advocate for you to get the care that you urgently need so that the care is delivered in a timely manner.
Right.
But why do we have this problem in the first place? Let's talk about that for a quick second.
Yeah.
If you look at healthcare funding in Canada, I learned this during my public health class last year. What they did was I was looking at this graph that showed healthcare funding across Canada. And we've had a bunch of different systems over the years, going all the way back to the time of Tommy Douglas when Canadian healthcare became a reality. Mm-hmm. But throughout all the systems, what they found was healthcare funding was gradually increasing relative to the population until sort of the 80s, 90s, late 80s, until about the late 80s, I'd say.
Right.
And then as soon as you hit the 90s, and ever since then, basically, until at least the pandemic or middle of the pandemic, last time I checked those stats, healthcare funding, inflation adjusted, has plateaued.
Oh. Yeah.
Meanwhile, our population has exploded.
Right.
Not just has our population exploded because of an increase in the younger population and immigration, but also because a lot of our population has aged. The average Canadian age has gone up a lot over that period of time, which means more of us need that healthcare that we so need, that is so important to us. And then what you realize is that the funding has basically plateaued.
And why? Do you know why that is? Or
it's a multifactorial issue, but one of them being that we had governments that didn't want to invest as much in healthcare at the moment, which continues to be the case, unfortunately. And now investment in healthcare not just means investing in healthcare directly that serves patients, but also investing in new research that our professors are conducting right now at the UBC hospital.
Yeah.
New research, new technologies, new training, new physicians and new nurses and other members of the healthcare team. All of that has been gutted because of an increasing population and disproportionately decreasing healthcare funding.
Right. Yeah, the lab I'm working in right now is actually doing something similar, and I think my professor, he got his PhD a while ago, and he recently got funding for something similar for technology, ultrasound technology in healthcare, and it can have a significant impact. We can go into another time, but it can have a significant impact on initial diagnostic screening. But he's been out of his PhD for a while, and it took him till now to get his funding. And only three, I think the award he got, around three professors got. So I can't imagine just the competitiveness to get funding for something that you feel like is going to impact the community, but you don't have it. You don't have the means.
Absolutely. So, yeah. And research funding is important not just because we're making an investment in the future and creating technologies that could not only put Canada on the forefront of research, but actually unlock things that will change the lives of millions of people, and not just the quantity of their life, but the quality of their life.
Mm-hmm.
And this wasn't the case forever. Canada was pretty much at the forefront of medical research until relatively recent times. We see insulin being one of those discoveries that is hailed in Canada. It's on the $100 bill now. The story of Dr. Charles Best, I think all of us have heard about how the discovery of insulin changed millions, if not billions of lives around the world. So we can get back to that. And another place where we see that research, a lack of funding to research, medical research, leads to societal harm is during the COVID-19 pandemic.
Mm-hmm.
One of the reasons that the United States was so efficient in their vaccine delivery program was not only that part of the vaccine was developed in the United States, with, of course, support from other countries, but also that they had several vaccine manufacturing companies, pharmaceutical companies functioning there with labs that were conducting research with federal grants in the United States.
Right.
We did not have that.
I actually talked to a business owner in Canada. She makes I forgot what it's a technology that helps someone who has internal bleeding and they need to go to the emergency. She had to get approval from the Canadian government and the U.S. government because her markets were in both countries. Gotcha. And they're based out in London, Ontario, and they had a much bigger expansion into the U.S. market because it's just so much easier to get things approved there. And the technology is way more widespread now in the U.S. market because it's just she can't get anything approved in Canada.
Wow.
So I haven't thought about that story in a while, but she told me that it's very difficult to get new technology approved in Canada, especially when it relates to someone's health. So and I guess that could.
I guess a criticism of that notion would be that Canada were just a little more cautious.
Yeah.
When the truth is, the lack of approval might come from the fact that we don't have enough people in Health Canada to approve and look into new technologies and to actually go in and look at the clinical trials or even fund the clinical trials that would lead to approval. So again, it's a lack of funding issue. And the FDA is perhaps the biggest health authority in the world. And, Health Canada in proportion, we've got about 10% of the United States population, but I don't think we spend nearly as much on Health Canada and other health research funding organizations like NSERC.
Right. Yeah. Okay.
Now, we talked about wait times quite a bit, but I want to break these down a little bit into different sections. There's pre-visit wait times, which is sort of the wait time before you see a primary care physician.
Yeah.
And that could be either at a walk-in clinic or at a family physician or your family doctor. Now, let's dive into that a little bit more before I talk about ER wait times and post-visit wait times. So could you talk about how bad the situation is when it comes to getting a family doctor? Why is it so hard? And if one of our listeners is looking for a family doctor in BC, what can they do?
Right. So I think the biggest thing is people don't know where to look. There are resources provided by a bunch of health authorities in BC. And this is primarily going to be about finding a family doctor in BC. We, on our website, healthfrontiers.ca, we have a guide to care, which I'll be basing a lot of my information off of. But if you're looking for another province, I'd say you can talk to us, and we'll look into that for you. But for now, it's going to be in BC. But the process of finding one is difficult, and it can be frustrating because it can take many months. But there are some resources which I'll go into right now. So there is the College of Physicians and Surgeons of British Columbia. They have a link, which is, again, on our website, in our Guides to Care, where if you click it... Sorry, my stomach is going crazy right now. But if you click the link, then you will find the contact information of over 650 practicing family physicians in British Columbia. And here, let's see what they have exactly. But I think that they have... Here, let's hit search.
And this website is the college?
Yeah, it's called the CPSBC.
Okay.
But yeah, here we have it up right now. They have their practice type, so family practice. If they're
whether or not they're accepting new patients right now?
They have registration class. I think that's whether or not they're accepting new patients. And also if they're practicing or not.
Gotcha.
And it has their contact information, so phone number, address, and fax.
Gotcha.
And I checked, and it's around... now it's almost 1,000. Over 1,000 pages, and each page is around 10-ish doctors. So, yeah, I think that's a good place to look. Again, if you're wondering where that is, it's the CPSBC.
So this would be sort of a cold call sort of procedure where you're looking up the contact information for family physicians in your area,
right,
and then reaching out to them.
Right.
Another resource where you can do that is HealthLink BC, which has a search directory that you can go to and select your city, and within that you can find different resources, including family physicians who are accepting new patients.
Right, and if you don't live in Metro Vancouver or Burnaby or Coquitlam or one of the major cities.
All that comes into the Lower Mainland.
Right. There is HealthLink PCNs, there are 6 PCNs. You might be a bit more familiar with this than I am, but through my research I found that if you live in North Delta West Newton, North Surrey Wally, Guildford, Cloverdale Panorama, Fleetwood, or East Newton, then there is a HealthLink service where you can go and sign up for a wait list to be registered for a family doctor, and it is first come, first serve.
So that's sort of the Fraser Valley and part of Greater Vancouver where you can be on a wait list, and they would sort of place you with the earliest possible family physician that's taking patients.
Right, and directly quoted from their website, pretty much what you said. Once registered, you will be added to the list in chronological order and contacted directly. So if you do live in one of those 6 PCNs, then you should go to the HealthLink PCN's website. It is, again, linked in our Family Care Guides to Care. There are a couple more doctor searches similar to CPSBC. So there's Pathways, and it's another British Columbia doctor search feature where it has over 100 family practices in British Columbia, and they update their list weekly.
Wow! So
it's up to date, and they have more than just that outside of primary care. So they have maternity care. They have if you're looking for a flu shot, stuff like that.
Alrighty. Yeah. Could you briefly also talk about 811 and what its role is in sort of this larger crisis that we have in the healthcare system? How can we rely on 811, and what can we rely on it for? When should one call 811? Right.
So if you want advice, over the phone about what you should do about your health, then you can call 811. It will connect you directly to a nurse, according to the website, a dietitian, an exercise professional, or a pharmacist.
Okay.
So if you don't have a doctor, and you're not sure what to do, and so you have some sort of health problem that you think you have. Sorry.
And we should mention that this is non-emergent line, and not an emergent line would always be 911 if someone's unconscious
or the emergency room or something like
yeah.
that. But yeah, if you are just unsure of what's going on in your body and you want some advice, then you would call 811.
Yeah.
Like I said, nurse, dietitian, exercise, pharmacist, you can call those people.
More often than not, what 811 has been for me and my family has been sort of a place where we call if we're unsure if we need to go into an ER right away, or if we can wait till we can see our family doctor. Which again, seeing a family doctor, even if you have one, sometimes the wait time, pre-visit wait times, we were coming back to that term, they can be up to weeks at a time, because sometimes doctors are busy, and what you get at the end of those weeks might just be a phone call using telehealth.
Right. And yeah, a lot of, I forgot the actual stat, but a lot of people in BC are not happy with telehealth services. I think about half of the population actually thinks that the telehealth services are good quality.
No, not just that. Nearly 60% of British Columbians find it difficult to access a doctor or have no access at all. This is a poll from the CBC, with 36% finding it difficult to get a doctor's appointment, and 23% don't have a doctor but want one.
Right.
So it's 23% of the entire BC population.
Wow. So HealthLink would be their alternative for while they're looking for a doctor, I guess.
811, yeah.
811
would be that.
Right. And if you do call 811 and something goes wrong with your advice on your health, and you want some further advice, we're here to help you, not on your health per se, but what you can do to get other advice on your health.
Absolutely. And that's a good segue into what I wanted to talk about, the purpose of Health Frontiers. I was talking about this earlier, but not just wait times, but also advocacy tends to be a big issue in the Canadian healthcare system.
Right.
Specifically, the fact that due to the systemic overload, due to the fact that physicians are under, or the entire healthcare teams, not just physicians but nurses, who are taking care of multiple patients way more than they're accustomed to or trained to safely do on a daily basis. Because of that systemic overload, what that leads to is a lot of unintentional neglect.
Right.
Where physicians just tend to be in a rush a lot of the times. And we were just talking to some of our friends earlier today, and they mentioned how going into local hospitals, going into local ERs, the atrocious wait times, first of all, sitting in those waiting rooms. I know I've spent upwards of 8 hours at a time.
Yeah, I had a story at UBC Hospital.
So tell me about that.
I was playing basketball, thought I hurt my wrist badly. I'd broken my wrist badly before. I guess broken my wrist badly is a funny way to say it. I broke my wrist before. You
did a good job at it.
Yeah, I did a good job at breaking the bone. And, well, I thought I did this time. I went to the hospital, and I was in the emergency wait room for, I'd say, 8 to 9 hours. And this was during a weekday. I missed class because of this. I was at the emergency room, and I didn't see a doctor until sorry, my stomach going crazy.
All good.
I had some chicken, and I think I had it out of the fridge for too long. So I'm not gonna have a fun time at home. Maybe I'll go to the emergency room.
Just do that for the purposes of this podcast. Just I'm just here to see how long it takes. As soon as they're like, all right, Adi, we'll see you now. You're like, no, I'm good. I just wanted to see how long it would take.
Actually, yeah, I purposely had bad chicken today to segue into the next part, which is I'm gonna go to the hospital.
Thanks for that sacrifice
and test the system out.
All right.
But yeah, what I was saying is, I was in the hospital for 9 hours, and I think at the end of it, I saw a doctor for 20 seconds.
20 seconds?
Yeah, after 9 hours. And they were like, nope, not broken. You're good to go. And it was like right about closing time for the emergency department.
Wow.
Yeah.
Okay.
So I went home. And then the funny part is, this is unrelated, but it's just a funny thing to add. They actually charged, like I'm an Albertan resident. I got billed through the AHS.
Mm-hmm.
They charged my parents because the AHS thing didn't go through for some reason, and it was, just guess the price.
I'm gonna say like it's gonna be something crazy, like $1,250.
No. It was $2,500.
Jesus.
I was there for 9 hours. Saw a doctor for 10 seconds.
20 seconds.
I don't know, dude.
But under a minute.
It was just. I don't know the exact number of seconds. I just know it was like, oh, it's not broken. You can go home.
Wow.
It was just it was less than a minute. Yeah, it was probably to be honest, it was probably like 30 or 40 seconds, but it was under a minute. It was just for 9 hours. It's incomparable.
It's not just like comparing it to the wait time, but I don't see how. Let's say you just walked in and saw a doctor right away. I don't see how anyone can receive due care over the span of 30 seconds. Yeah,
right.
It's just not possible. When you gotta understand when you go into an ER, which I hope doesn't happen too often, but when it does happen, you're there to make sure that there's nothing that is particularly wrong or anything that's going to cause long-term damage to your health, and you want to be reassured and you want to be heard. I think that's a basic expectation of every patient and something that they truly deserve.
Right. And it's not on the doctors either. It's just on the system that the doctors are put in.
Absolutely. Yeah.
They're made to see patients for 5 minutes at a time. And my dad is a family doctor. He used to work in the UK, and I've heard
they have the NHS there.
The NHS, and to him it was worse actually there.
So last thing I want to talk about before we get out of here is just a little bit about Health Frontiers Canada. When we started, I think the vision was to have sort of three major pillars.
Yeah.
The first pillar was patient advocacy, sort of one-on-one. And that's our Community Partners Program, where if you go on the Get Support tab on our page, healthfrontiers.ca, you'll see the Get Support tab where you can fill out a form. And that form comes directly to us. And we can get in touch with you to help you navigate healthcare with us.
Yeah.
To see how we can be in your corner. If you don't have a family physician, if you don't have someone, a family member or someone who is there to advocate for you.
And sorry to interrupt. We will fight against the neglect that we talked about before.
Yeah.
About how, say a doctor comes in and understandably he's rushed or he or she is rushed or something like that.
Yeah.
We will make sure that you do get due care or something like that.
Well, we can't guarantee that we'll get due care. I think both of us, in our experience as volunteers in different healthcare settings, as research assistants in different healthcare settings, and having been taught by a number of different physicians, we have gained the sort of expertise in how to navigate the healthcare system as patients. And I think that is what we bring to the table, and that's what we want to share with other people who perhaps can't advocate for themselves as effectively as they would have been without, say, a language barrier.
Right.
I've found just tremendously in my time as an ER volunteer that people who don't speak English as a first language, it is tremendously hard to get the care you need, to understand your options.
Yeah.
Sometimes all you need is someone to sit with you and help you maybe take notes as your doctor is, throwing a million different options at you, and you want to figure out what's the best course of treatment for you.
And the thing is about language translation during COVID, and as an ER volunteer too, we weren't allowed to send families of patients back with the patients. So often, if the patient didn't know English and their family knew English, we couldn't send them back, and they had no one to translate for them. And we did have a translation robot type of thing.
Oh, come on!
And you kind of speak to the robot comes, you select your language, which language you want to translate. You get connected to an operator.
Wow!
So there was no in-person translation, and it was the robot was pretty loud, so it was kind of blasting in the whole room about the stuff you should be talking about privately with.
I don't see how they thought an operator robot is a good idea.
I was setting it up for a patient, and I wasn't comfortable just using it. And
I understand you translated for some people.
I did. I eventually was screw this. I have, I'd say, proficient Hindi. Okay. I'm not fluent in Hindi. Mm-hmm. The person I was speaking to, he knew Hindi and a little bit of Punjabi. But I translated for him, and I know you're fluent in a few Indian languages.
Absolutely. And we can always connect with other people who are within our vicinity who are volunteers at Health Frontiers, and sort of set people up with these community partners who can not only go to help you set up visits by making phone calls for you, but also go to these visits with you to ensure that you're not missing anything that the doctor said.
And we're working on having a diverse range of volunteers so that they can translate for people from many different backgrounds.
Absolutely.
I think we're restricted to different states in India, which is still a bit, but there are many people coming in BC from many places.
Also, if you're interested in helping us out, and if you think you have this ability to navigate the healthcare system and would like to lend your time to Health Frontiers Canada, there's also a Get Involved page over on our website that you can fill out a form to get in touch with us, and after a due process, we'd be happy to have you on board and get some have some reading materials on how to talk to your physician that come to us from the UBC Faculty of Medicine, and there's a bunch of different resources they have on their website called Talk to Your Doctor, and also other resources for people who don't speak English as a first language. But this isn't just limited to new immigrants or people who don't speak English as a first language, but also all sorts of other groups that have been marginalized, including the queer community, or just perhaps people who are aged or living with a disability that prevents them from getting access to care as easily as they deserve to get care.
Right. There are many factors that intimidate, that can make the healthcare system so intimidating. And
absolutely.
We're here to help you with all of them. We're your shoulder to lean on.
Absolutely. Another pillar, so the first pillar was sort of one-on-one patient advocacy.
Yeah.
The second pillar was creating media that brings attention to this issue. One of the reasons that this episode is called the Silent Treatment Desert is that the lack of treatment has been very silent. It's been very quiet.
Yeah.
And we want to shed light on this issue. We want to improve the resolution on this issue.
Right.
That goes back to us coming up with a name for this thing.
Yeah.
Let's quickly go through this and try to figure out if we can get a name before we end the first episode. Yeah. I'm thinking like something, like I said earlier, something about enhancing the resolution, like a more refined.
Yeah.
There we go.
Yeah. Oh.
Resolution refined.
I like it. I mess with
refined resolution. Resolution refined.
Resolution refined. I like resolution refined. What do you think?
I think refined.
Refined resolution.
What do you like better?
To be honest, I'm messing more with resolution refined.
You know what? I like it. It's sort of like 99% invisible. I like it.
Yeah.
All right. Resolution refined.
Yeah, with Hriday
and Adi. That brings us to the final pillar of Health Frontiers Canada, which was that once we bring attention to this issue, we want to get in touch with the people who are truly in positions to make changes when it comes to the healthcare system, to make it so, to change those things, those systemic issues, that lack of funding that has plagued the healthcare system for so long, for decades at this point.
Right. And I think that will primarily be through the podcast, actually, through Resolution Refined.
Resolution Refined.
We plan on talking to MPs,
absolutely. MLAs.
Anyone who has some sort of influence in the healthcare system in BC and in Canada. And not only... those are the guests that will kind of be related to our third prong. Mm-hmm. And then we'll have guests outside of that too. But
for sure. And, I think over our time here at UBC and in the healthcare system, we've come across a number of amazing individuals who have that expertise, who understand this issue even more so than we do.
Of course.
Who have an insider's perspective on what's going on here in Canada. And to be able to have them on, to engage them in conversation and see what we can do as a population, because, as much as it doesn't feel like it sometimes, we live in a democracy.
Yeah.
And in a place where, like I earlier said, 60% of British Columbians don't feel like they have access to a doctor in a timely manner. That is unacceptable. And if the majority feels that they can't access the care that they truly deserve, we're doing a massive disservice to them.
Yeah.
And something has got to change.
Yeah, and I think it starts with talking and going right up to the people that have some sort of power and telling them what we think, and these statistics too, because I think it's somewhat of the people's responsibility to make people in power aware of the issues that are faced by like the common people. So
Absolutely.
I think through our podcast, I think we can play some sort of role in that.
That's what we're here for. I think that's exactly the vision
Yeah.
that I had for Health Frontiers, where we're a patient advocacy group and one of the goals is to bring attention to what is going on and not to fall into the trap of that utopian ideal that we talked about earlier.
Yeah.
Of thinking that everything is perfect, or thinking if you just don't think about it, if you just don't need care, if you're just healthy enough, you won't ever get into an issue.
Right. I think we're trying to set up the system in a way that when people need help, the help is available to them immediately, and the right help is available to them, so that when something does go wrong, they're not caught in the system that we are in right now. And I think that's our biggest goal with the podcast.
So this is Health Frontiers Canada. This is Hriday and Adi signing off from Resolution Refined.
Yes, that is what we're signing off from.
Alrighty. That's a cut.
I like it.
I love it.